welcome back to Ahead of the Curve. I'm your host, Dr. Megan Teed. Today, we're going to be talking about avoiding surgical treatment for scoliosis with the Schroth Method. So if you've been listening for the past few weeks, we've been talking pretty in depth about the nature of the Schroth Method, kind of the rationale for how it helps and how it works. And this week, we're going to be talking more about specifically how it helps people avoid surgical interventions, if that is the direction that you are feeling like you want to go. So with that all said, there are instances where it's not possible to avoid surgical intervention. And we'll talk a little bit about that just to start off with. So there are times where the curve is so rapidly progressing in adolescence where the child is, the curve is beyond 40 degrees. It is a situation where they haven't hit puberty yet, and their Reiser sign is 0. So the Reiser sign is a sign that we use looking at an x-ray. So we look at someone's hip, and there's shading and there's capping that happens as the child progresses, or as the person grows into puberty and goes through puberty. And the further along they are into puberty, the more capped their hip looks and appears in the x-ray, and the less growing they have to happen. So that person would be like at a 4 or 5 if their hip is looking like it's fully capped. Someone who's at a 0 or a 1 has a lot of growing to do yet, and their chances for progression are much higher. So obviously everything is individualized. It's always up to you whether or not that is the avenue that you want to go. But if you are someone who has a child who hasn't gone through puberty yet, hasn't menstruated yet, and their curve is around 40 degrees, that means that their likelihood for their curve progressing is much, much higher. Especially if you're not doing any interventions to help break that progression. Like we've talked about before, the reason why it's so important to detect scoliosis early on is to break the vicious cycle of scoliosis, meaning we want to break the asymmetrical loading that happens, which creates more bone growth on one side of the vertebrae, less bone growth on the other side of the vertebrae, to break that perpetuation. And we do that with the Schroth method. So that's why early detection is super, super essential and important. And we know now that scoliosis progresses beyond adolescence into adulthood. So it's never too late to begin addressing this through the Schroth method. And, some other instances where surgical intervention may be essential is when you're an adult and you're experiencing a tremendous amount of disability and low function due to your scoliosis. So you've tried physical therapy, you've tried scoliosis specific exercise without any relief. You're getting persistent nerve pain, leg weakness, and it's unrelenting. that's another time that you may want to consider surgical intervention when you've pretty much tried everything that there is to try, all of the conservative avenues that there are to try without success. Now, with that said, if you do decide to go the surgical route, there's a few things to be aware of. So, just because you're choosing to do surgery, it doesn't mean that you won't still have some form of scoliosis afterwards. A lot of times when they go in for the surgery, they're going in and they're fusing the worst part of the curve. So they're stabilizing that part of the curve. And then, the areas above and below it, they are left unfused to give you some freedom for movement and range of motion and mobility. And what happens with those areas surrounding the curve is those areas, they tend to continue to progress if they're left untreated. So if you go and you get the surgical fusion and they stabilize part of your curve and then they leave the remainder unfused and you don't have any follow-up treatment that is scoliosis specific, that would be a time that those curves have the ability and the likelihood of progressing and causing you some pain and disability in the future. Even if you don't have scoliosis, when you get a spinal fusion, there is something called spinal fusion syndrome, where the areas surrounding the area that is fused, they want to move more, or they have more of a demand to move because, the segments that are fused that used to take some of that range of motion and some of that mobility, they're no longer able to do so. So the other areas of your spine, they need to compensate and kind of step it up and move a little bit more. And that causes additional strain and stress to the surrounding areas. So that's why generally you're referred to physical therapy even after you've had a spinal fusion that isn't for scoliosis, in order to strengthen those surrounding areas. And with the Schroth method, the reason that this is superior to traditional physical therapy for avoiding surgical interventions is it teaches you how to symmetrically load your spine. And that's not just with exercise, that's not just with manual interventions, it is also with retraining your baseline positioning. So your auto corrections, meaning you are taught how to hold yourself and position yourself in a way that is symmetrically loading your spine. And it's one thing to be able to do that for a few minutes. You're standing and you're looking in front of the mirror. You have your Schroth therapist with you, and they're putting their hands on you and correcting you. But it's another thing to integrate that into your life. So that's the most important element of the Schroth method, of any scoliosis specific exercise, is that integration element, making sure that you're taking what you're learning during your sessions and you're integrating that into your life. So how are you sitting when you're working at your desk during the day? How are you standing when you're washing your dishes? Are you holding yourself in your auto corrections, or are you falling into your curve and perpetuating that asymmetrical loading of the spine and feeding the vicious cycle? So those are the main ways that the Schroth method differs from traditional physical therapy in having the ability to actually help people avoid surgery in the future. So I've had some personal experience with clients of mine that I've worked with who have, they've seen me for the working on the Schroth method, and at the same time they are doing some bracing, and their curves are a bit more progressed, a bit more advanced, and they're in the 50s, but the curve is at the point where it's remaining stable. Now they have the education and the ability to, continue to counter that curve and continue to strengthen in their corrected positioning and their alignment. And they're very active. So all of that is really beneficial in helping to avoid disability in the future and pain in the future. And then even in adulthood, I've worked with clients who have been able to successfully avoid surgery. I've spoken about some of them before, and their scoliosis is quite progressed, and surgery isn't an option for them because they have osteoporosis. And they've been able to go from, really being in a lifestyle of a sedentary lifestyle, inactive lifestyle, and now they're able to go for walks with their partner, with their husband, and they're actually really seeing changes happen. I'm seeing changes happen in a reduction of their curve. So it is possible to be, like I've said so many times, it is possible to make changes at any age. I work with clients who are in their, the youngest that I've worked with is probably 8 years old, and the oldest that I've worked with is 98 years old. And, everybody in between those ages, they have seen a lot of benefit through doing scoliosis specific exercise, Schroth method if we're in person, Pilates for scoliosis if we're working in a virtual capacity. So if you are someone who is considering surgery for scoliosis, just make sure that you have tried all of the different avenues available to you. Have you tried the Schroth method scoliosis specific exercise? Have you tried bracing if you are an adolescent? Have you tried even massage and acupuncture, craniosacral therapy? All of these things are more conservative avenues to make sure that you've explored before you go in and have a major surgery. And remember that it is always up to you if you get the surgery or not. It is not up to your doctor to tell you that this is what you must do. It's definitely important for you to take into consideration their advice and their wisdom and their guidance. But it's always ultimately your decision to make that choice or not. So, just to kind of conclude and wrap up, that, the Schroth method is a wonderful avenue to help avoid surgical treatment for scoliosis because it breaks that vicious cycle of the asymmetrical loading. Again, making sure that you explore non-surgical options and consult with specialists to consider the benefits of the Schroth method in your scoliosis management journey. And even if you've had the surgery, it can be very beneficial to explore that as well, because a lot of times you may not have pain initially, but in the future that tends to kind of be something that creeps up on people. So I love to hear your feedback and your thoughts, your experiences. If you are someone who's considering surgery, or if you've had surgery for your scoliosis in the past, I'd love to hear your experience and your thoughts on this topic. Thanks for tuning in to Ahead of the Curve. Until next time, make sure that you stay well and stay ahead of the curve.